I'm Yared Alamu, founder and CEO of TQIntelligence. So I'm a huge fan of psychotherapy. Have benefited immensely from a good quality mental health in my past, and then also was able to go to school, spend a lot of time in school. I'm a psychologist by training. And being able to see this issue from both sides, both as a client for an extended period of time, and then a psychologist including research, clinical work. I've trained a bunch of psychologists. I've managed large behavioral health agencies, and so coming to TQIntelligence is a culmination of all these both personal as well as professional experiences. And in dealing with mental health, specifically as it relates to quality mental health, it's a difficult problem to address. It's decades in making. And so the way that we been addressing that is really put together a team that is multidisciplinary, both from the clinical, technology, research, and business, in being able to leverage that experience systematically to produce for our product. And so we have a collaboration with scientists in a number of different universities. Internally, we have specific engineers, for example, focusing on voice, since that's our primary product. And also have a number of psychologists that are working with us in terms of addressing some of the potential bias issues as it relates to our algorithm. And so where we are right now is that we have been funded by the National Science Foundation, phase 1 and phase 2. By the time we finish with the National Science Foundation, about mid-2023, we have about a couple of $1 million that we have been granted and that used for a number of different purposes. We also have been funded by Google, and we have an ongoing collaboration with the Google Voice team. We have a senior voice engineer as part of our team that really kind of allow us to see in the most recent developments as it relates to AI and voice technology. And we raised more than $300,000 in equity in addition to that. And then we're able to build these strategic relationships with a number of different agencies that allows us to continue to make progress. So the reason this is a problem, that the reason we have an issue is the quality or the difficulty of providing mental health services for children, adolescents from low-income communities. It really has to do with these kind of adverse childhood experiences. These are traumas that kids experience. And so the more trauma you have in terms of the different types, right? These are not just you have a history of emotional, physical, sexual abuse. This is an extended version of that. Parental incarceration, parental substance abuse, divorce. So encompasses a whole set of experiences that are problematic from perspective of a developing child, right? And so it is problematic partly because trauma is primarily a physiological experience, and it tends to stick around physiologically. And there's a benefit finding out how much of this is an issue as early as possible and intervene accordingly. So there is both a financial cost in terms of the human cost and the actual money related costs. So if you, for example, look at the consequences of these inadequate mental health services, right? You see a 76% increase in the last 25 years in the number of suicide attempts that African-American kids have been making. In 2018, suicide is the second leading cause of death for African-American kids between the ages of 10 and 14. And in general, suicide in 2020, this data is prior to COVID, about 6,000 young people between age 10 and 24 have completed and died of suicide, right? So suicide is in some ways is a gauge to how bad the problem is, right? We sometimes don't really have an objective way of figuring out how bad the person is experiencing emotional distress. One way that you can actually see that is in the level of a whole set of suicidality behaviors that are problematic, and the cost is also pretty significant, right? So if you have a child that is have a chronic disease and add one more mental health issues, and that mental health issue is not addressed, the cost could 3 or 4 times of what actually in someone who doesn't have this, right? So if we spoke to a number of different payers, and the concern that they have is this thing has been unsustainable in terms of a year-to-year inflation, how much it will cost to contain this issue. So their cost is and has to do with people going into emergency rooms and hospitals with very little that warrants in terms of these problems, and they work, especially kids who are in this system of care that we're talking about. 95% of them in this Medicare managed care, and Medicare managed care lives under capitation, right? So anytime someone went to an emergency room or a hospital unnecessarily, that kind of start to challenge the capitation that they have, and they're beginning to push down this risk of capitation towards the providers. The providers are not equipped to manage these issues systematically. That's where we come in, is that we have an end-to-end product that allows us to be able to quantify the severity of the problem, right, and provide that data in real time to the providers, in allowing them to make decisions based upon data, and also have them complete the clinical notes along with the other clinical information that we provide. So we automated this whole process, build this data infrastructure, and most specifically is that we're able to use about a 60-second voice sample to be able to quantify the severity of the emotional distress, right? So we know that mental health tend to be very subjective. It depends on which therapies you see, and but voice, in the way that we use voice, right, cuts through all that subjectivity. Use that brief voice sample, quantify the severity of the problem, and provide that data in real time to healthcare providers so they can make decisions in terms of the status of where the treatment is going for that person, right? So the target market we're focusing on is these about 5 million kids that are receiving mental health services through the Medicaid system. And this is among the 45 million kids that are covered by, someone said about, Medicaid. Medicaid is the largest payer when it comes to behavioral health services. So there are 5 million kids that are receiving mental health services currently. And from our perspective, if we, just focus on the 3 or 4% of that population, right, we're able to make a whole bunch of money, as well as really make a significant difference. So that's kind of what we're targeting from now. And we think that we can be productive by 2023, 2024, and capturing that targeted market size by 2026. And to be able to do that, right, for us, we're planning to raise our seed round in sometime in late Q2 and early Q3 of 2022. We have competitors. There's a lot of great voice companies. What makes us different from them is that we're focusing on children and adolescents, and then children and adolescents from low-income communities. So that makes a huge difference in terms of what kind of algorithm that you design, what kind of intervention, what kind of solutions that you provide. So we don't, a lot of these voice companies have been recently raised a lot of money, and we don't feel like we're that far in terms of the algorithm, but they just tend to have the advantage of providing services to adults versus we providing services to children that from low-income communities. I'll be happy to answer if you have any questions.